everyone, and welcome to another video from YouTube Nurse. Today we're diving into Unit 3 of English for Careers Nursing, Hospital Admissions. First up, we'll walk through how to describe the hospital admission procedure, step by step, so it's clear and easy. Then we'll learn how to talk about what happened to a patient using the right kind of language. We'll also dive into some grammar with past simple versus past continuous. Don't worry, I'll make it simple and fun for you. After that, we'll practice filling out a patient record card like a pro. And finally, we'll wrap it all up by writing a clear, professional patient summary. So grab your notebook and let's get started. Before we jump into the lesson, there's something important we need to cover first. Let's talk about 3 important types of patients you'll hear about in any hospital setting. Knowing the difference is key before we move forward. Let's break it down. First up, we have the outpatient. This is someone who visits the hospital or clinic for treatment, but doesn't stay overnight. Think of quick visits like checkups, blood tests, or minor procedures. In and out, nice and simple. Next is the inpatient. These patients are admitted to the hospital and stay overnight, or longer. They usually need more serious or extended care, like recovery after surgery or close monitoring. And finally, there's the day patient. This one's in between. They come in for a procedure or treatment and go home the same day. No overnight stay, but it's more than a quick checkup. So now that you've got those 3 down, outpatient, inpatient, and day patient, you're ready to dive into the rest of the lesson. Let's go! Let's jump into a quick speaking activity. Work in pairs, or team up with a classmate or friend. A few patients have just arrived at the hospital and are waiting in reception. Your job? Talk about why you think each one is there. Could it be a broken bone? Maybe they're feeling dizzy? Or perhaps they're just there for a routine appointment. Use your imagination, practice your medical vocabulary, and have fun with it. Once you've shared your ideas, we'll move on to the next part of the lesson. Let's do it! As always, before we listen to the recording, let's take a quick look at what question 2 is asking. It's always helpful to know what to focus on. So question 2 says, listen to the patients describe their problem and decide which one is speaking. All right. Now you'll hear a few patients talking about their health issues. Each one has something different going on. Your task is to listen carefully and figure out which person is speaking. Pay attention to any symptoms, emotions, or clues in their voice. And after that, move on to question 3. Decide the order 1 to 5 in which the patients should be seen. So think about, who sounds like they need urgent help? Who can wait a little longer? Use your judgment and maybe even discuss it with a partner. Ready? Let's play this speaking and see what we can pick up.
Unit 3. Scrub up. 1.
I was at a party and one of my friends gave me a little white tablet. I'd had a few drinks and I was feeling good and I took it, even though I didn't know what it was. It made me feel, really weird. I could see and hear really strange things, and it scared me. I still don't feel normal today, and I'm very worried.
2. It's not due until next month, but when I was washing up this morning, there was a little blood. It worried me. Then I got these pains. 3.
I was working high up on a ladder. My foot slipped and I fell. I hit my head, but there is no blood and I don't feel too bad.
4.
I was walking by the river and I think I stepped on it and it bit me. I don't know what type it was, but it was long and silver with a black head.
5.
I was looking in the mirror and I saw this big spot on my face.
I checked it on the internet, and I'm sure I've got cancer. Do you think I'm going to die?
Okay, we've just listened to the recording. Now it's time to dive into the answers together. Let's see how well you caught those key details. Pay close attention as we check each one. I'll highlight the important points to help you improve next time. Ready? Let's break it down step by step. 1. It's patient E that's speaking. As you listen, she's worried that she may have taken some pills at the party and is having some side effects. You can focus on the details the patient shares, like what substances they might have taken, how much, and any symptoms they're experiencing, like confusion, drowsiness, or difficulty breathing. These clues will help you identify who's speaking. 2. It's patient A that's speaking. She shared, like how she feels, any symptoms she's experiencing, or her concerns about her pregnancy. 3. It's patients B that explain he fell off the ladder, but he has no problems or symptoms. 4. It's patients D that talking. As you listen, pay attention to key details about the snake bite, like where the bite is located. In the picture, we see a bite mark on his leg. 5. It's patient C that describe her problem. Pay attention to key details, like how the spot looks, whether it's painful or itchy, or if they've had any other symptoms alongside it. These clues will help you connect the dots and determine the most likely explanation. All right, nurses, before we dive into the answers, let's pause and take a quick look at question 3. In question 3 asks us to decide the order 1 to 5 in which the patients should be seen. This is all about prioritization. Think critically. Who needs immediate attention? Who can safely wait a little longer? Use your judgment and focus on the urgency of each patient's symptoms. Let's talk a little about triage. Triage is a medical process used to determine the priority of patients' treatments based on the severity of their condition. It's commonly applied in emergency situations, hospitals, or disaster scenarios where healthcare professionals must decide who needs immediate care and who can wait. The term comes from the French word trier, which means to sort. Here's how it typically works. Assessment. Patients are quickly assessed for vital signs, symptoms, and overall stability. Categorization. Based on the assessment, they are placed into categories like immediate, delayed, or non-urgent. Immediate. For life-threatening conditions needing urgent attention, for example, severe bleeding or breathing difficulties. Delayed. For less critical conditions that can wait a bit, for example, minor injuries. Non-urgent. For patients with mild issues who can wait longer, for example, sore throats or mild headaches. Resource allocation. Care and resources are distributed efficiently to maximize the number of lives saved or patients treated effectively. In essence, triage helps healthcare professionals manage resources effectively during high-pressure situations, while ensuring the most critical cases receive attention first. Got it? Perfect. Now let's check the answers together step by step for question 2 and see how well we did. Here's what we've got. 1. Possible overdose. This is the top priority. Overdoses can be life-threatening, so immediate care is critical to stabilize the patient and prevent serious harm. 2. Snake bite. Coming in second place, snake bites can lead to rapid complications like venom spread or allergic reactions. It's an urgent case, so act fast. 3. Possible concussion. While not always life-threatening, concussions can cause serious issues like brain swelling or loss of consciousness. Prompt evaluation is key. 4. Pregnancy. Unless there are complications like heavy bleeding, this is typically less urgent than the cases above. Still important, but manageable. 5. Spot on the face. Unless there are signs of infection or severe symptoms, this is usually a non-urgent concern and can wait a little longer. Now you know how to prioritize in a triage setting. Ready to test your skills or dive deeper into any of these cases? Let me know. In the vocabulary section, your go-to master words while diving into real-world scenarios. Today we're tackling hospital admissions. So picture this. You're feeling unwell and step into the hospital. Here's how it goes down. 1. Take a seat in the waiting room, grab a magazine, and maybe check your watch once or twice. 2. Next up, you'll meet a pro, the triage nurse, who's specially trained to prioritize patient care. 3. This nurse will perform an initial assessment of your symptoms to figure out what's going on. 4. From there, your situation gets ranked by urgency, who's a priority and who can wait a little longer. 5. But don't worry, if your condition is life-threatening, you'll see a doctor as soon as possible. No queues for emergencies. 6. The registration process follows, where a nurse collects your personal details and fills out the hospital paperwork. 7. Once there's a free cubicle, a doctor calls you in to discuss your case. 8. And finally, the doctor determines the appropriate treatment to get you back on your feet. Now it's over to you. Have you ever experienced the admissions process? Got an unusual hospital story? Share your adventure in the comments. We'd love to hear all about it. Don't forget to like, subscribe, and ring the notification bell for more enlightening content. Well, as you remember previously on vocabulary, we talked everything about porters, those behind-the-scenes champions. But today, we're switching gears to focus on receptionists. Get ready to dive into what makes them the frontline multitaskers of any organization. For question 1, brainstorm the key responsibilities of receptionists in your hospital. Then either write them down or discuss them with your partner. Let's jump into question 2. We're looking into the life of Carmen, a hospital receptionist and the ultimate multitasker. Let's read it together. Carmen Dornan, I'm a hospital receptionist. If you need to find somebody, or if you need to know anything about the hospital, ask me. If you want new paper towels or you need to speak to a surgeon, ask me. I often meet people when they are frightened, angry, or drunk, so it's important to be diplomatic and strong. I often need to reassure people, so it's important to be calm. My normal work is to greet and assist patients when they arrive, make appointments for patients, record patients' information, and organize and file patient records. I also keep the accounts. You need to be very organized to do this job. Of course, I have to operate a computer, a fax machine, and other office equipment. But I also have to know first aid and understand medical terminology and abbreviations. My biggest problems are with the handwriting of medical staff. It wastes a lot of time when I don't understand reports and forms because of handwriting or abbreviations. I believe that without me and the other receptionists, the whole hospital would come to a stop. Now let us return to question 2. 1. Diplomatic, strong, calm, and organized. That's the receptionist starter pack. They've mastered the art of cool under pressure. 2. Bad handwriting and excessive abbreviations. Yep, they're battling the secret code of medical staff daily. It's like trying to decode hieroglyphics on the clock. 3. First aid and medical terminology. You bet! Receptionists are low-key medical ninjas, understanding lingo and staying prepared for anything. You can now compare your brainstorm with Carmen's description of her job and responsibilities at the hospital. As you see, the patient record, often referred to as a medical record or health record, is a detailed compilation of a patient's health information and history. It includes 1. Personal information. Basic details like name, date of birth, address, and contact information. 2. Medical history. Documentation of past illnesses, treatments, surgeries, allergies, and family health history. 3. Clinical notes. Records from healthcare providers detailing symptoms, diagnoses, treatments, and follow-ups. 4. Test results, lab reports, imaging studies like X-rays or MRIs, and any other diagnostic findings. 5. Medication lists, information about prescribed drugs, dosage, and administration history. 6. Procedures. Notes on medical or surgical procedures performed. 7. Progress updates, observations of the patient's condition over time. Patient records are essential for providing accurate and continuous health care. They help medical professionals make informed decisions, track progress, and coordinate care across different specialties. Modern systems often store these records electronically for easy access and improved efficiency. As you know, one of the most important software programs in this field is Epic, and you can find related tutorials in its playlist. All right, you can take the patient record and match it up with the Scrub Up section to see which Scrub Up patient has their details recorded on the form. It's all about connecting the dots and making sure everything lines up perfectly. Let's break down the abbreviations found in this patient record. DOB stand for date of birth, the patient's birthday, in shorthand form. M stand for male, it's the patient's gender. NA means not applicable, meaning this question doesn't apply to the patient. GP stand for general practitioner, the patient's family doctor. Per means in each day, week, and so on, shorthand for frequency or rate. NO stand for number, used for contact details like phone numbers. These abbreviations help save space and keep records concise. Receptionists and medical staff use them to make documentation quicker and more efficient, though it might feel like decoding a secret language at times. Let me know if you need anything to explain further. That's enough for now. In the next part, we'll continue with the listening section. Stay tuned and see you in the next video.